My name's Jackie. I'm the Band 6 for Sidmouth Hospital. I've worked in community hospitals for 25 years. This one is very different from the one I've just come from. They all work hard. All of them have got their own challenges. The reason for that is because the communities are different. So the Axminster community is different from the Seaton community. Community hospitals are not like they used to be. They used to be seen as these little cottage hospitals. They're not like that now. We do lots of end-of-life care. We have to be on the ball to know when they're deteriorating, when their needs are not that obvious. We have to work autonomously quite often. Good thing about working in a community hospital is that for me, when I was at Axminster, I live in that locality, so it was really nice to be able to work with the patients that you might know. You understand where they're coming from. There's a lot of communication with other agencies such as hospice or speech and language, community nurses, complex care teams. There are quite a lot of challenges. You don't really know what's going to happen. Things can change really quickly. Here you have to be able to think outside the box a little bit. So it's really good development to learn those little extra skills or more subtle recognition skills of your patient. It's not dull. There's no time to be bored. The focus of patient needs is different. It's about having people in near their own home, so getting them fit for discharge, being able to provide them with the help in the community, etc. The acute unit does what it does very well. It overcomes the immediate need of the patient, but then it's our job to carry that on. I would say it's a good place to be. Like I said, I've done it for an awfully long time now. I wouldn't really want to change. I have explored other avenues and I've come back to this.
My name's David. I'm a deputy matron at Sidmouth Hospital. I've been in nursing now for just over 20 years. Really enjoy my job. When I was looking for jobs, I visited the community hospitals. Really liked what I saw. I liked the quality of care that I was seeing. Worked in Seaton for about 4.5 years before coming to Sidmouth and then gained promotion. I enjoy the job because it's almost like one-to-one care at times. You really get to know the patients. From the day of admission, you're planning for their discharge. It's not just nursing, it's a multidisciplinary team. So you're working closely with physiotherapists, occupational therapists, general practitioners who usually lead the care.
So I was quite surprised when she first did come through that door, because I didn't realise I was going to have my doctor night, you see. When I knew I was coming here, I thank the doctor very much for getting me here, because this is my hospital and I only live around the corner.
It's very rewarding to work here. With regular staff, permanent staff, then things could be even better. One member of staff I'm working with now, newly qualified at Seaton, and she progressed up the ladder and she's now got promotion. She's a Band 6 onward care facilitator, done extremely well. So there is room to develop. If nurses want to then move on to the acute sector, they can. Get involved in outpatient clinics as well as the ward. It isn't just the ward. We've got audiology here. We're expanding to ophthalmology. We've got X-ray here. We've got a minor injuries unit.
When I decided to do my return to practice course, I applied at Plymouth University. I wasn't entirely sure what the course would entail. The study days and the practical side I wasn't quite so concerned about, but the writing had changed very much from when I did my original training. I had a really good mentor as well, and lots of other support from staff at Sidmouth Hospital, and I did get through it. I did find it hard, but I managed to get through. Really, my first few shifts were just spent with the healthcare assistants, getting back to hands-on nursing. I have remained in a community hospital because I enjoy the ethos of the community hospital. I enjoy working locally. I enjoy the challenges that we have. I very much enjoy being part of the team. The patients that we have are quite diverse. We do have, contrary to popular opinion, some quite young patients. We take patients direct admission from community, so patients from their home. We also have patients transferring back from Exeter, mainly for ongoing rehabilitation, but we also have a direct link with hospice and provide end-of-life care for patients as well, and that is an area that I have developed a real interest in and have become the link nurse for end-of-life care. We also have patients coming in for daycare, blood transfusions, etc. The advantages of having multiple roles are that the patients are interlinked. So patients that I may see in minor injuries, I may again see on the ward. I really enjoy working in the community hospital. I plan to spend the rest of my career working in a community hospital and to develop my skills as best I can.
The way you looked after that is absolutely fantastic. Because, I mean, they're on their legs all day working hard, and yet they still have a nice way with them. There's nothing, you know, abrupt or anything. There's always a nice smile.